Croup, an overview. Croup, an overview. We'll be going over the learning content, which includes the pathophysiology, medications, lab and diagnostics, interventions, and patient education. What is croup? Croup is a common respiratory illness in children from 6 months old to 3 years old. Their conditions include upper airway infection that leads to swelling of the larynx, trachea, and bronchi. The subglottal area is the narrowest part of the child's airway. Swelling increases the work of breathing and can lead to stridor, restrictions, and respiratory distress. Symptoms are often more worse at night due to changes in the airway's activity.
Symptoms: bark and cough, inspiratory stridor, hoarseness, running nose, and congestion. Root causes: pneumonia, influenza, RSV, and adenovirus.
Illness duration. Nebulizer rapidly decreases airway swelling and improves breathing in moderate severe cases, and it affects in short term, so observation is needed after administration. Acetonium or ibuprofen relieves fever and discomfort, making the child more comfortable and less irritable. Humidifier or cooling mist therapy. Humidifier air or cool mist therapy, not medication, but helps soothe airway irritation and easing your breathing. For non-pharmacal treatment, we have calm environment to keep your infant, preventing them from worsening air objects from crying. That didn't make sense. Keeping the infant calm to prevent worsening airway obstructions from crying. Also, we have upright positioning, holding infant upright to ease breathing and reduce air pressure. Cool misting and humidification moistens the air and reduces swelling and irritation, and can use a humidifier or sit in a steamy bathroom briefly. Also, you can sit in a cool outdoor area. It'll shorten your periods short periods outside, and cool night air may help shrink swollen air tissues. Also, you want to be sure to have adequate fluids, encouraging breastfeeding or bottle feeding to prevent dehydration. And then obviously observe for respiratory distress, watch for stridor or rest reactions, cyanosis, or lethargic, seeking any emergency care if any of those occur. And then minimal handling during acute episodes limits the agitation that could worsen airway and narrowing.
Lab and diagnostic, CBC and viral panel, neck x-ray, pulse oximetry, and vaccines. A clinical diagnosis is based on symptoms and child's healthcare. Neck x-ray will show the steeple signs, which is narrowing. Pulse oximetry monitors oxygen saturation. Labs are usually not required unless bacterial infection is suspected. A swab can be done as well. Nursing care. Maintain patient's airway, administer humidified oxygen, give steroids as needed, encourage fluids. Best position is to sit upright in a tripod position. Providing patient with ice chips, popsicles, or cool water helps soothe the throat.
Nursing care. Watch for complications such as drooling, lethargy, toxic appearance. If a patient is drooling, this could be a sign of difficulty swallowing and potential airway obstruction. Lethargy can suggest worsening hypoxia or exhaustion from increased work of breathing. Toxic appearance may signal an infection or impending respiratory failure. Patient teaching. At-home care includes using a humidifier, sit in a steamy bathroom, sit in a calm, upright position, and also get an adequate hydration. Warning signs needing emergency care include experiencing stridor at rest, retractions or cyanosis, medication teaching, steroids must be completed as prescribed, give acetaminophen, ibuprofen appropriately, seek medical attention if no improvement within 3 to 5 days or if you are declining rapidly.